Hello everybody, myself Dr. Saksham Jain, consultant neurologist at Park Super Specialty Hospital, Patiala. Every year, October 29th is observed as World Stroke Day. Likewise, the theme for this year is to create awareness amongst the public about what is stroke and how to recognize it and the benefit of reaching a stroke-ready hospital in the early stage after having a stroke. So, what is stroke? Now, stroke is a neurological disorder in which there is interruption of blood flow to a part of the brain, and this interruption can be in two ways. One is an ischemic stroke, where there is a clot that is formed in the blood vessel in the brain which prevents the further flow of blood. That is called an ischemic stroke. Second is a brain hemorrhage or a hemorrhagic stroke, in which a blood vessel ruptures and there is bleeding in the brain. So broadly, these are the two types of stroke. Now, how to recognize stroke? For this, there is a simple mnemonic: B FAST. B-E-F-A-S-T. B stands for balance. The patient has sudden imbalance. He is unable to walk without support. E is for eyes, when there is loss of vision or decreased vision in one or both the eyes. F is for facial deviation or drooping. So when the patient is asked to smile or show teeth, then the face deviates to one side. A stands for arm weakness. So the patient is asked to outstretch his arms, then the weakened arm, it goes down, rotates, or can also go outwards. That is arm weakness. S stands for speech. So the patient's speech becomes unclear, or he is unable to understand and respond clearly. T is time. So if any of these symptoms are present, then it is time to call an ambulance. So what is the advantage of reaching the hospital early? Now, it is known that in stroke, every minute 1.5 million nerve cells die. So it is no joke, as reaching early would mean we are able to prevent disability and achieve better results. Now, what is the standard of therapy which is available? Now, when a patient with stroke reaches the hospital, then the stroke team immediately gets into action and the type of stroke is identified. The neurologist assesses the patient and makes a diagnosis of the type of stroke, whether ischemic or hemorrhagic, and the treatment is initiated. Now, if the patient reaches in early stage within the first 4.5 hours of stroke, then we have this therapy called intravenous thrombolysis, in which a clot buster injection is given, which dissolves the clot and restores the flow of blood to the brain. So you see, the take-home message is time is brain, and if stroke is diagnosed early and treatment is initiated, then a lot of lives can be saved. Thank you.